Hello everyone, welcome to Dentistionary. We are back with our last lecture in cardiovascular unit, and our topic for today will be the cardiac output and shock. In last lecture, we have already discussed about the cardiac cycle and hope it's clear to you guys. Usually, you get long answer on cardiac cycle and cardiac output, whereas you get different types of short notes on shock. You all can ask your doubts in the comment box. We also provide you the PDFs of these slides in the description box. So, let's begin. Firstly, the definition of cardiac output. What is cardiac output? It is the amount of blood pumped from each ventricle. Usually, it refers to the left ventricular output throughout. Correct? Hope so this is clear to you. Next, what is cardiac output? It is the most important factor in cardiovascular system because the rate of blood flow, yes, the blood flow through different parts of the body depends upon cardiac output. It can be explained in three major ways. Firstly, the stroke volume, next is the minute volume, and lastly is the cardiac volume. So it's obvious that a question arises, what are stroke volume, minute volume, and cardiac volume, right? Okay, so let us discuss. Firstly, the stroke volume. It is the amount of blood pumped out by each ventricle during each beat. Please keep in mind, during each beat, the amount of blood pumped out by each ventricle is termed as stroke volume. What is the normal value? It's approximately 70 milliliter. Correct? Obviously, when the heartbeat is near about 72 beats per minute. Now comes the minute volume. What is minute volume? It is the amount of blood pumped out by each ventricle in 1 minute. In last one we heard in each beat, and now it's in 1 minute. So there's a difference. Minute volume can also be represented as the product of stroke volume and heart rate. Stroke volume, let it be SV, into heart rate. Heartbeat rate. Okay. And lastly, what is cardiac volume? Okay, so what is the approximate value of minute volume? It is 5 liter per ventricle per minute. Clear? Next is the cardiac volume. This is so obvious to you guys. What is cardiac volume? So moving next. So what are the factors maintaining cardiac output? There are many factors which maintain the cardiac output, namely the venous return. Next is the force of contraction, then the heart rate, and finally the peripheral resistance. Slowly and steadily, we'll discuss in detail about these factors. First is the venous return. What is venous return? It is the amount of blood which is returned to the heart from different parts of the body. So, different parts of the body से जो भी heart में blood return आता है, that is what? That is the venous return. Clear? When it increases, what happens? The ventricular filling and the cardiac output is increased. See, the cardiac output is being affected. Thus, the cardiac output can be said to be directly proportional to the venous return. Clear? Moving forward, a next factor is the force of contraction. Cardiac output is directly proportional to the force of contraction, keeping the other three factors constant. According to Frank-Starling law, the force of contraction of heart is directly proportional to the initial length of the muscle fibers before the onset of contraction. So, contraction होने के पहले जो initial length था muscle fibers का, force of contraction उसी पे directly depend करता है. Clear? Force of contraction directly proportional to the initial length. It also depends upon the preload and afterload. Next come the heart rate. Cardiac output here also it is directly proportional to the heart rate, keeping other three factors constant. Moderate change in heart does not alter cardiac output. Yes, obviously, moderate changes तो होती रहती है. 72 to 80 beats is obvious. Okay. If there is a marked increase in heart rate, the cardiac output is also increased. clear, and if there is marked decrease, the cardiac output decreases. Hope so this much is clear. Till now, all the three factors are directly proportional to cardiac output. Next comes the peripheral resistance. Firstly, what is peripheral resistance? It is the resistance offered to the blood flow at the peripheral blood vessels. ब्लड वेसल्स के पेरिफेरी में जो रेजिस्टेंस ऑफर किया जाता है किसको, ब्लड फ्लो को, दैट इज कॉल्ड पेरिफेरल रेजिस्टेंस. क्लियर? इट इज द रेजिस्टेंस अगेंस्ट विच द हार्ट हैज टू पंप ब्लड. इस रेजिस्टेंस को क्रॉस करके हार्ट को ब्लड पंप करना पड़ता है. सो द कार्डियक आउटपुट इनवर्सली, प्लीज कीप इन माइंड, इनवर्सली प्रोपोर्शनल. सो हमने चार फैक्टर्स पढ़े, जिससे पहला क्या था, वीनस रिटर्न, जिसके साथ डायरेक्टली प्रोपोर्शनल था कार्डियक आउटपुट. वीआर मींस वीनस रिटर्न, सीओ मींस द कार्डियक आउटपुट. ओके, नेक्स्ट वाज द फोर्स ऑफ कॉन्ट्रैक्शन, जिसके साथ भी वो डायरेक्टली प्रोपोर्शनल था. थर्ड वाज हार्ट रेट, जिसके साथ भी वो डायरेक्टली प्रोपोर्शनल था. बट फाइनली द peripheral resistance was inversely proportional to cardiac output, 1 by CO. Okay, so this much is clear to you all. Moving forward is a distribution chart which is given in AKGen. You can include this chart in your answer. Next is the most important part of cardiac output, that is the measurement. How will you measure the cardiac output? There are 2 to 3 different methods, like the direct method, which includes the Fick, or it is said to be direct Fick method, which follows the Fick's principle. And the remaining 2 methods will be discussed in the further slides. Firstly, we come the direct Fick method. What is direct Fick method? The Fick principle states that the amount of substance taken up by an organ per unit of time is equal to the arterial level of the substance minus the venous level times the blood flow. That is, the amount of substance taken per minute is equal to A minus V, means arterial minus venous difference of the substance into the blood flow per minute. You can see the formula here. Blood flow is equal to amount of substance taken per minute divided by the difference between the arterial and venous flow. Clear? See here, I have mentioned the entire formula and the entire procedure to calculate the final answer. See, let me show you. LV means lung volume output. Okay. Amount of oxygen consumed by the whole body per unit time divided by A minus V, oxygen difference across the lung. These are the standard values, which will come 250 by 5 into 100. That's approximately 5 liter per minute. Hope so this much is clear to you all. Moving forward is our next method, that is the indicator or dye dilution method. What is indicator dye dilution method? See the formula. F is equal to I by CT, where F is what? It is the blood flow. I means the total amount of dye injected. C is the mean concentration. And finally, T is the duration of time in seconds. Please note, in seconds. So what is the principle? A known amount of dye is first injected into an arm vein. Then it first passes through the heart and then to the pulmonary circulation. And finally, it is evenly distributed in the bloodstream. Correct? How can you calculate the blood flow? You can use this formula. Please note these 2 formulas. This is very, very, very important. And you must include these 2 methods in your cardiac output answer. Clear? Here's the end of cardiac output. Next topic is physiology of shock. One of the most favoritely asked short notes in your professional exams. There's nothing tough in it. You can easily write that whatever I've mentioned, you can write this much is enough for you all. The definition, the types, and our next slide, I'll provide you the chart. This much is enough for your short note. So what is shock? It is a clinical syndrome characterized by impairment of adequate tissue perfusion, primarily due to the low cardiac output. Definitely shock का मतलब आप सभी को पता है, but in physiology terms, it is a clinical syndrome that is characterized by impairment of adequate tissue perfusion. Means tissue perfusions के impairment के कारण जो भी clinical syndrome होते हैं, that is called shock. Okay, mostly it occurs due to low cardiac output. Mostly it occurs due to low cardiac output. Clear? What are the types of shock? Firstly, the hypovolemic shock. Next is the distributive shock, cardiogenic shock, and finally the obstructive shock. Okay? Please learn this by heart. It is very important. Next, let me show you the chart which I was talking about. Yes, here it is. It has been extracted from AKGen. Definitely you must be knowing it. So firstly, it is the hypovolemic shock. What is it? A simple definition and a cause. The amount of fluid in the vascular system is inadequate to fill, resulting in decrease in circulating blood volume. What are the causes? Hemorrhage and dehydration. Simple. In simple terms, it has been mentioned in AKGen. Please read it properly. You guys will be able to understand it. Okay? There are four different types of shock, namely the hypovolemic shock, distributive shock, cardiogenic shock, and lastly the obstructive shock. Clear? Please mention these causes. These are very, very important. You should include this in your answer. So that's it we have in cardiovascular system, in cardiovascular system unit. So thank you so much. Keep supporting and keep sharing our channel Dentistionary and keep sharing your love. Thank you. In our next lecture, we'll start a new unit. Mostly it will be on the endocrine system. Till then, keep learning and thank you so much.